It's Dr. Cassie Smith, and welcome to Back to the Basics, a simple approach to health in the modern world. I appreciate you taking the time to join me today and hopefully learn ways that could help you improve your health. The modern world has left little time to focus on health and wellness. I hope to give you some quick and simple ways to be well and live your best life. Hello, welcome back to this week's episode of Back to the Basics. I'm excited that you guys joined me this week. We are going to talk about a topic this week that a lot of you ask me about, which is cortisol. So I get a lot of messages about cortisol. Can cortisol be high? Can it be too high? Can it be low? Can it be too low? What do I do about it? And so I have some cortisol experts with me. And so I'm excited to introduce you guys to them. And so I'm actually probably just going to let them introduce themselves. But they are with a company called Rebalance. And so this kind of started after Justin's wife was really sick. So he has a wife named JoJo, was super sick. And he was very frustrated because she actually had Cushing's. And so he developed, was trying to get her better, and in the interim, while he was trying to get her better, made a company and kind of became passionate about cortisol. He then, I guess, met Dr. Dorfman, and so I'll kind of let you guys explain how the company came about, but they're here to kind of talk to us about a study he was telling me about that's very interesting as far as cortisol and hormone. So who wants to go first?
Justin.
I didn't say Dr. Dorfman.
Yeah.
So my name is Justin. Hi. I am co-founder, CEO, president of Rebalance Health. And I'm just thrilled to be invited onto your podcast. So thank you for having me. I'll hand it over to Todd.
Hi, my name is Todd Dorfman. So I'm a physician in Boulder, Colorado, and it sounds like my practice is similar in a lot of ways to yours, Dr. Smith. And Justin found me when he came to Colorado, and actually before that happened, I was asked to vet the company by a couple of investors, and so I had sort of heard what was going on with the company. I thought it made a lot of sense, and then I didn't really hear anything for quite a while, and then all of a sudden Justin reached out to me, and I became the chief medical officer, and also really excited because I've been able to be a big part of the studies that we have, and to me, kind of scientific evidence-based medicine is super important, and I think with the Rebalance product, we really kind of broken that barrier from a nutraceutical or supraceutical standpoint, because we have really good science behind it. So it's exciting to move forward.
Dina?
And I'm Dina Keenan. I'm the CMO of Rebalance Health. I've been with Justin and Dr. Dorfman since October of last year. So I oversee all the advertising, marketing, PR, and been on the product faithfully since then. So thanks for having us.
Of course. Okay, so before we started, Justin and I were kind of just briefly discussing cortisol in general and how he got here. And he was very passionate about it. I liked it. And so he's gonna talk to us a little bit about, I guess, just tell me what you were telling them about what made you decide that this was something that was very important. I mean, I understand that cortisol is important. I'm an endocrinologist. As you were saying, not all endocrinologists understand that cortisol is very important, but I do. I do understand that it affects a lot of things: your sleep, your mood, your hormones, everything, basically, right? Your ability to make muscle. And you've figured some of this out, and you guys have done some pretty fascinating studies, it sounds like. So give everyone like a 5-minute spiel about how all this started and what you've been doing.
Yeah, absolutely. So basically, my wife has a severe traumatic brain injury that occurred in 1995. Not just a concussion type, but literally she's missing 25% of her front parietal lobe, completely atrophied. It's gone. So she's a walking miracle in of herself, because she shouldn't be walking or talking the way that she does. But because she had such a severe injury, we think it had damaged maybe the hypothalamus. We know it definitely damaged the vagus nerve. And so she was deteriorating at a faster rate, just in the aging process and how you function, a little bit faster than most would. And all of a sudden, she started getting really, really tired, and she had no energy, and she was losing a lot of weight, and then she couldn't get much sleep. And through multiple different doctors and tests, she was eventually diagnosed with Cushing's. It got pretty bad. She was basically bedridden for 6 months, and it was scary. Myself, my kids, we thought we were going to lose her at some point. Funny enough, it was Dr. Dorfman that helped turn her around and change that diagnosis with the treatments and the kind of the processes that we've been going through. But during that process, I was infuriated because drugs didn't work, pharmaceuticals didn't work, alternative medicines didn't work, supplements didn't work. And my background is in building products that actually have efficacy. My last company was Elastin Skincare, which is the number one medical grade skincare line in the country. And so I had experience in formulations and really delivery of ingredients. That is really what my expertise would be, is actually getting the ingredients into the body where they need to go. And so when we kind of decided that we wanted to do something and really take matters into our own hands, we basically sought for the best doctors in all different areas of expertise around the country, whether it be naturopaths, MDs, endocrinologists, and so forth. Everyone came together and we started putting a list of ingredients with known benefits to support cortisol. And we ended up with a massive list of like 30 or 40 ingredients. Usual suspects: ashwagandha, cordyceps, those types of ingredients, maca, ginseng, wonderful ingredients that have a proven history. Then we looked at delivery systems and we're like, okay, what delivery system is the best? And we know subcutaneous injection is by far the best, but that would be a pharmaceutical. And so we took a leaf out of the zinc lozenge kind of strategy and said, let's go with the lozenge, because sublingual delivery or nasal spray are the next best delivery mechanisms. And we don't have to go through a huge amount of FDA protocol studies to get there. It won't take 10 years and a lot of money. So let's go the supplement route. The next thing we did was we looked at metabolism. And this is where Todd and I really kind of started to brainstorm. Your body utilizes whatever fuel you put in it, liquid or solids, every 4 to 6 hours. We have a metabolism. That's why we have breakfast, lunch, and dinner. The metabolism is a key component that I think supplement companies have overlooked. If you think about pain medication, you take it every 4 to 6 hours. Antibiotics every 4 to 6 hours. Flu cold medication, 4 to 6 hours. There's a reason: metabolism. And so when we looked at cortisol, we kind of looked at it as a master hormone. When cortisol is super elevated, it actually suppresses your body's ability to make the other hormones. And so therefore, that's how we decided it was a master hormone. And so in order to get cortisol in line, we felt like we needed to give it as much support that made sense. And hence we ended up with a 3 lozenge system to support cortisol. Then something really interesting happened. We did a whole bunch of studies. We did efficacy studies. We were tracing ingredients, and we came across some interesting issues. Most supplements can't be traced in the blood. You just can't find them. They're made of natural, organic, from Mother Nature. You can't trace them. There's no assay that has been developed to trace it in the blood. We went to KSM-66, ashwagandha, the top ashwagandha supplier in the world. Can't prove that it actually gets into the body. Mm-hmm. And so we went to the next route. We said, okay, well, we believe that melatonin is a great ingredient, and you make melatonin yourself. So we can trace it. So let's trace melatonin. Let's compare multiple different products with different deliveries. And we'll take blood samples every 10 minutes for, 4 hours, 5 hours. Let's see what happens. And we found that our delivery system was significantly more effective than other products on the market with different delivery modalities. We did a study. It was published by a Swiss medical journal called Vitamins and Minerals earlier this year, because they felt that it was extremely credible. And it went through their review board, their doctors, their scientists, to get to the point where they agreed to publish it. But as we were selling the product on cortisol, something very interesting happened. People coming to us, customers, saying, I've been going through menopause and my hot flashes have gone. I've never been able to sleep. I'm sleeping through the night. I'm losing weight. I'm down 3 pant sizes. My anxiety is gone. I'm much more even. And we're like, that's interesting. Are you sure? They're like, absolutely. Todd and I were ruthless. We said, can you come off the product, please? And when they came off the product, their symptoms came back. They went back on the product, their symptoms went away. And so we said, you know what, this is really interesting. And we took a really deep look at it, and Todd's like, yeah, of course it makes sense. If your cortisol is lower and super low at night, you're going to fall asleep quickly and you're going to stay asleep. If your cortisol is high, you're going to stay awake in bed and you're going to have all these monkey brain thoughts going on. And what do I have to do tomorrow? And the kid's safe? And did I turn the stove off? And so forth. And so you can't get to sleep. And if you do fall asleep, odds are you wake up again. And if that pattern occurs, you don't get into a healthy sleep cycle with good sleep hygiene. You need to go into a light, then to a deep sleep, then to a REM cycle, and then you rinse and repeat, as you know, 3, 4, 5 times a night. Mm-hmm. What people don't realize is that if you wake up in the night, you actually forfeit the deep sleep. And the deep sleep is where the magic happens. That's where you make your hormones for the next day. That is an aha moment right there. Hormones are manufactured nightly for the following day. You don't make hormones that can last you all week. You don't make them in the middle of the afternoon. You make your hormones in your deep sleep. And if you don't get enough deep sleep, which is typically 60 to 90 minutes in a full 7 to 8 hour sleep cycle, if you don't get it full 7 to 8 hours or you wake up, you actually forfeit the deep, which means you're at a hormone deficit for the next day. Too many nights of a sleep deficit, and you're in a downward spiral.
Yeah, so I talk to people about this a lot. The other things that affect your REM sleep or your deep sleep are alcohol, right? So alcohol greatly affects your REM sleep. And so that's why, I get a lot of hate for this. I'm not saying you can never drink alcohol. I'm not saying I don't ever drink alcohol. But if you stop drinking alcohol, you will notice a tremendous difference in your sleep. And if you don't believe me, wear an Oura ring because it will tell you, right? Like
we agree with you wholeheartedly. But I can give you one more vice that's far more toxic and deadly than cortisol. Let me introduce you to technology.
Yep, I would agree. The blue lights from technology, 100%.
Not just the blue lights. When I was a kid, and I was born in the 70s, right, there was no email, there was no internet. There was no cell phone. You typically went to bed at a reasonable hour, and you'd wake up in the morning. Today, we're binge watching movies, whereas 30 years ago, we went to Blockbusters and picked 1 or 2 movies for the weekend with the family. And so we're addicted to content, we're addicted to technology, and anything that happens from this device is actually negative. It raises your cortisol level because you have anxiety around this all the time. What's that ding? How many likes? Am I following? Did my emails come in? Did I get paid? Where's my bill? Did my mortgage due? Where's my kids? It all comes from this. This has got nothing but negative news. And so we have now been trained for the better part of 30 years to be a slave to technology. And because it's 24/7, and I can hear the dings going off in the background on the computer, right? That is causing our anxiety level, our cortisol levels to keep us up at night. And so our cortisol levels elevating. So I agree with you. As we get older, it's harder to get sleep. It's harder to fall asleep. It's important to be in a good sleep hygiene rhythm. Like you said, try not to have alcohol in the evening. If you're going to have a glass of wine at lunch, brilliant. At night, why? It's not a sedative. It actually becomes a,
stimulant.
Stimulant, thank you. It stimulates you. So everyone thinks it puts you to sleep. But 4 hours later, it's a stimulant and you're up and you're using the bathroom. And so don't have food, don't have water super late at night. Why? We're getting old. Our bodies can't hold it. We're going to need the bathroom, right? Don't be on screens 2 hours before. Why? Blue light emulates sunlight and it tricks your body into releasing more cortisol, which will keep you awake. So there's a lifestyle pattern that goes along with this. We're certainly not a magic pill. But we ended up doing a clinical study, an IRB clinical study, 104 women with debilitating menopausal symptoms, debilitating, nothing worked, had not been on HRT because they couldn't. 25% of the population cannot go on HRT because of the cancer risk. Out of that study that lasted 90 days, 100% efficacy, all women saw a reduction in hot flashes. not by 10%, not by 20%. The average was an 80% reduction in hot flashes. Halfway through this study, the data was so compelling, the North American Menopause Society invited Dr. Dorfman to present at their annual meeting to thousands of doctors about the outcome of the study. And earlier this year, the Medical Journal of Nutraceuticals and Food Science published the full study, which revealed massive numbers, 80% reduction in hot flashes, 80% reduction in sleep quality, sleep improvement, energy, endurance for working out, libido increases, hair, skin, and nails increases, all related to cortisol. Because what happened was cortisol was low, they fell asleep, they stayed asleep, they made the hormones that they needed to function the next day, including the progesterone and the estrogen they needed to function to offset the symptoms of menopause. But if cortisol is high and you can't sleep, you're not going to make the progesterone and estrogen, and therefore your menopausal symptoms are going to be significantly worse.
Yeah, that makes sense. 100%. Your brain has to clean itself when you're sleeping, and you have to make all your hormones, right? That's when we make our growth hormone. Very important when we're sleeping.
Absolutely. The HGH, the growth hormones, all these hormones that help us recover so that we can be our best the next day. It's very simple. When we were in college or we were at school or we partied super late at night, how did we function the next day? We didn't. We were zombies, right? And if we actually got a good night's sleep, we were rock stars. It's no different as we get older. It's just you make less hormones, so it impacts you on a much greater scale.
Okay. So, Dr. Dorfman, tell me how you came about. Tell us a little bit about you. What do you do all day long? What's it like to be in your clinic?
In my shoes?
Yeah.
Well, I think much like what we were talking about earlier off air, I see a ton of patients that have tricky, difficult medical problems, people that have seen several other physicians or, alternative practitioners. And a lot of those problems are around hormones, other sorts of endocrine problems, diabetes, poorly managed pre-diabetes, poorly managed advanced heart disease, everything, down to a new patient today was one of the few survivors of pancreatic cancer and had a Whipple procedure, pancreas removed about 6 years ago. So obviously that leads to all sorts of problems because the pancreas is obviously quite important to produce different hormones and things. So I kind of sit down and spend several hours with each patient, and I come up with a game plan, and I help them sort of walk through and map out that game plan. So I'm more of a detective, a medical detective or investigator, so to speak, in a lot of ways. My interest in hormones came about years ago, where I was originally an emergency trauma physician and worked in the hospital setting for almost 30 years, but had this practice the whole time, and it became more and more interesting. I left the hospital system a few years ago and focused full time on the practice, and basically did a bunch of additional training along the way, and endocrinology and hormone type management. So the patients that we're talking about, the patients that are helped by the Rebalance product, are really kind of my bread and butter everyday sort of patients. And maybe a place to start is to tell you how I use the product clinically, because I think there's a really important role for the product clinically. So as you know, Dr. Smith, and probably most of the viewers know, whenever you introduce any sort of therapy, you have to kind of weigh the risks and the benefits of that therapy. And the Rebalance product really is almost a freebie in the sense that it's all on the benefit side, and we don't really find any risks. The chief science officer and myself go through all of the potential issues with the product, and there have been zero reportable side effects to the FDA. It's been fairly remarkable in terms of, tens of thousands of people have tried this product, and we haven't had any permanent or untoward effects. No one's needed to go to the hospital. Nothing bad has happened. So if I have someone, a woman, for example, who's sort of perimenopausal or just starting menopause, one of the first things I'll do is put them on the Rebalance product, because I may be able to completely fix them with the product, and that happens in a high percentage of cases. But even if I can't completely fix them, even if they're having 20 hot flashes a day, and I've knocked that down to 5, and they're like, you know what, I'm in business meetings, I can't even have 5, I can't have 1, I can't have any. Even if I do have to utilize a small amount of more traditional hormone replacement therapy, I'm using it at much lower doses. So, as therefore I'm risking, have less risk breast cancer, uterine cancer, and the other sort of things that go with it. So I try and employ the product as a first line for hormone management in females in menopause, in men and women who have low testosterone and clinical syndromes that go with that. Obviously, we were sort of talking initially about anxiety, and there's this continuum in the world, right, between stress, and how does stress then turn into anxiety, and really those are based on triggers, right? So stress is something that is like a stress response. A bear is in front of you, you have an appropriate cortisol release and an appropriate stress response, but then your cortisol levels have to come back down to baseline. Anxiety is you have a redlined high cortisol level because you're just worrying all day that a bear is going to run in front of you, and there's no bear. And I think in today's society, as Justin mentioned, with the advent of all this technology, wondering what's happening. You wake up to use the restroom in the middle of the night, and then all of a sudden you need to check your email because you're wondering if someone got back to you or something. And I'm guilty of this to some extent and try my best not to do it. But part of the key is the balance of the hormones and how we can bring cortisol back into balance. So you do have that ability to redline when you need to, when a bear's in front of you. But you also have the ability to bring it back down to normal so it doesn't disrupt your sleep. It doesn't, one of the things with too much cortisol is you don't produce several hormones. One of them is thyroid hormone, for example. So your metabolism decreases. You have a higher propensity to put on weight. Too much cortisol causes a release of glucose. That glucose then is released all day. You end up with blood sugar problems, metabolic problems. You put on abdominal fat. So it's this sort of vicious cycle. And the idea of the product is really what it says, to balance the hormones in a way where we have the ability to secrete cortisol when it's helpful, and we don't secrete it when it's not helpful, so it's not disrupting other body processes.
Yeah, and to that point, I would say too, cortisol, I see this a lot. So people who have a lot of cortisol, right, they are very anxious, but when you're also making a lot of cortisol, your blood sugar is higher, you're going to have poor gut flora, right? Your akkermansia is going to be low, and then you're going to get dysbiosis in your gut. And then when you have dysbiosis in your gut, again, you're not going to absorb things. So your vitamins, your minerals, you're not going to be able to convert thyroid hormone. So I actually saw that today. I saw a lady today who, has been doing fine on thyroid medicine, but then over the last 6 weeks has gained like 11 pounds and she didn't know why. Super constipated. So obviously her gut's not working. Her insulin's probably high. Her TSH was 50. 3 months ago, it was 3. And I'm like, okay, so obviously we have a gut issue here. We have a cortisol issue here. We have lots of issues, right? But it all plays together. And, most doctors are going to say, well, she's just not taking her medicine, or, oh, let's switch her to a different medicine, or, no, obviously something changed in the last 3 months. What is it? And then, when I had a conversation with her, it was, well, my son died and I've been really stressed. And, so it all plays back to cortisol. And then it's like, on top of that, she's missed work. And so now she's stressed out with work because she's behind in work. And then we put all these pressures on ourselves and, our family. And it's just it's true. People are so stressed these days. with the dinging and the emails and I've tried very hard to have boundaries with my phone, and I think I've done a pretty good job. I put it on airplane mode when I go to sleep at night. I have some good boundaries. I have social media people now, so I don't have to do all of that, which is nice. So if I don't respond to you on social media immediately, it's because I'm taking my boundaries, people. So, but yeah, I mean, it's so true. Cortisol is, and I see levels. I'm sure you do too, right? So I check cortisol levels.
Yeah, so do I.
Yeah, I have people who work for me who I've checked their levels recently, and we're talking 25 plus, 26, 27. And I'm like, dear God, like, what is going on? Am I really that terrible to work for?
You're not paying them enough. It's easy.
No, I don't think it's that. Well, in my defense, the person who I checked recently, whose cortisol is very high, doesn't work for me full time. They also have an ER job, which I'm trying to get them out of the ER because that shift work back and forth business is not good for you. So
I agree. Spending 30 years doing that. Yeah.
You did it. Yeah. I did it too. I did a lot of moonlighting in a VA hospital overnight and then working during the day. And it is awful.
Yep.
Like you don't know when to sleep. You don't know when to turn it off. You don't know when to, now I am very structured. Like you were saying, Justin, like I have a bedtime. My alarm goes off when I'm supposed to start getting ready for bed. I go get ready for bed. I'm in bed by a certain time. My eyes are closed. It's just like I'm very structured. Even when we travel, I get made fun of a lot because if we travel somewhere, I don't care. I'm still on my body's time zone, right? So like if I go to the West Coast, I'm going to bed at like 7:30, 7:45. I don't care. Because my body says it's 9:45, like it's time to go to bed,
Right.
We're in the same town. We have dinner reservations at 4:30. I mean,
absolutely.
we understand what it is.
So to all my friends who give me crap because we make dinner reservations at 5:00, Justin says that's good. And to my other friends who give me crap about brunch, like this is why I love to brunch, people. You can have a little champagne at brunch. You can finish out your day. It doesn't affect your sleep and you're good, right? Like I'm a huge bruncher.
One thing that I thought was really interesting is when we did the direct line study where we measured melatonin in the body, we really saw something that was really eye-opening. Melatonin is a fabulous ingredient. It helps you fall asleep very quickly, but it metabolizes in about 3 hours or less. And so it's not uncommon for people that when they take melatonin, they wake up at 2 a.m. Yeah. So melatonin is great at helping you fall asleep. It is not very good at helping you stay asleep. And I think that's a really important point to make because a lot of people rely on melatonin. And even though it's not a hormone that you stop making when you take, unlike testosterone, for example, which, after 12, 18 months, your body has a very high percentage chance that it'll never make it again. Melatonin just becomes less effective, so to speak, right? You're breaking that cycle, kind of less effective. It still works, but you just have to take more and more and more. So, melatonin is a great ingredient, but you really ought to train your body to cycle on and off of it in order to make sure that it is as effective for you as it possibly can be.
Yeah. Yeah. And, cortisol is very important, but then all your hormones play together, like we were talking about, right? So for women, progesterone is very important for your sleep too, right? Even for men. So there's studies now that show progesterone is actually important for men's sleep. I don't know if you guys know that, but you guys need a little bit of progesterone as well. And so like cortisol is very important. Progesterone is very important. Thyroid hormone, growth factor. We were talking about that growth hormone, super important. Like all these things are important for your sleep. Estrogen, testosterone, they all have to be working. And so, you and I were talking about before this started, there are all these pop-up clinics. I believe you said people are doing hormones like they do Botox was what you said, which is true and sad, but you have to understand hormones before you give someone hormones, right? You have to have the right dose, the right route, the right, timing for a hormone. And it also has to play well with everything else that's going on. And that's kind of what I tell people is like, well, we can work on your hormones if that's what you want to do, but we really need to go back to the very basics, which is like, what is your cortisol? How are your cell membranes? How is your gut? Are you sleeping? All of these things are important.
Yeah. The thing about the hormones is these clinics pop up and they're like, okay, great, we can put you on TRT, or great, we can put you on estrogen and progesterone, right? But like Dr. Dorfman has educated all of us, you have to treat the entire person and the entire endocrine system as a whole. You can't just pick one hormone and take it, because it'll throw the other hormones off in the wrong ratios. And Dr. Dorfman can talk about this. I want to put words in his mouth. But the general perspective that I take on this is that no endocrinologist can tell any patient what their ideal number should be. You can't do that. There's no test that you could administer to tell me what my ideal ratio should be. What you can do is take a baseline. And then from that baseline, you ask me a whole bunch of subjective questions about lifestyle, sleep habits, energy levels, mental clarity. And then you make a educated guess as to what might move the needle in the right direction for my symptoms and my complaints. And then you'll say, come back in 90 days and let's do it again, and let's see what happened with the blood work, and let's see how you're feeling. So essentially, it's a unique experiment on each patient one by one, because that's the only way you can help someone understand what's working and what's not working with hormones. You certainly can't go in and just say, I need more testosterone, the more the better, because that isn't the case. There's a lot of men that function at a lower level of testosterone compared to someone that may have a higher level of testosterone. Men could be at 1200 and be miserable. And there's men that can be at 350 and be like, that works for me. I'm good.
Do you like what you've heard so far? If so, Modern Endocrine is now able to provide telehealth services in 8 states, including Arizona, Nevada, Oklahoma, Texas, Ohio, Illinois, Michigan, and Georgia. If you would like to become a patient, visit our website at www.modern-endocrine.com/contact. You can also email us at hello@modern-endocrine.com or call our office at 405-286-1571 to schedule an appointment. Please note, we no longer accept insurance for new patients. However, we do have customizable membership programs available. Your first visit will include a detailed intake, and lab orders will be provided to further assist us in developing your 10 stages to ultimate health plan. We do offer discounted lab rates with a nationwide lab service. And now back to the show.
No, I completely agree. I ask all my patients as soon as I walk in the room, how do you feel today? And I think they get annoyed, but it's because I use that to know, like, okay, so this is a good baseline for you, or this is not. And then I make a note, like it's always there, right? So then if ideally people feel good when they come in, but if I have people that they're like, I don't feel well. Okay, well, let's look at your labs that you just had done. Now let's go back and look 3 months ago. Okay, you felt well 3 months ago. What is different? Let's look at your labs. And then I can usually kind of figure out based on lab values what to kind of pull out of them, like, oh, I'm stressed because my son died, or I lost my job, I haven't been exercising, or I'm not sleeping, but that it's true. Like, and I'm sure you feel like this too, Dr. Dorfman. I tell my husband, like, I'm a detective. Like, I just think all day long. It's actually really hard. Like, it's just like, but it's like questions, and you're just, and it's hard. It's especially, I've been training my nurse practitioner and my PA, Summer and Ashley, and they are amazing. They're so good. But like, sometimes when you're training them, it's hard because it's like, I can't really, you know what I mean? Like, it's just, I don't know. I've seen, thousands of patients, and you just kind of have to listen to people. You have to understand how everything works together. And then you have to realize that everyone is different. So to your point, Justin, like, just because my free T3 level is 4.0 and I feel good, it doesn't mean that, you're going to feel well with that level. Same thing with testosterone. I saw a lady today whose testosterone, I was like, holy cow, this is way too high. This is not good. Her sex hormone binding globulin was really high too, though. But I went in there and she's like, I've never felt better in my life. I don't have a single bad hormone, not one, or not a single bad. I don't have a single side effect. Like, I went through all of them with her. No side effects. She feels great, and her hormones have never been that high. So then my next question to her was, okay, great. Then why is your sex hormone binding globulin high, and why did it take this much hormone to make you feel well? So then we start talking about, are you detoxing? What's going on with your cortisol? How is your gut? So, but to your point, like, a lot of doctors will walk in there and say, this is too high. I don't care. We're not giving you this,
Right.
And so it's.
Yeah. I mean, I have exactly the same conversation. I tell patients, look, this lab range is everyone from someone who's 8 years old to someone who's 80 years old, and you're, 45 years old. We need to get you dialed in exactly like you guys were saying, we need to dial in a range. We need to figure out how you're doing clinically in that range, and we need to utilize the range moving forward in case you don't feel well clinically. And I take the same, the same exact approach. And it's hard, like you mentioned, because there's so many variables, right? Like you said, well, maybe they're having an argument with their spouse, maybe they got fired from their job, maybe they have financial issues, maybe everything's going beautifully and they just got a new car. Like who knows what's going on, but the bottom line is that all has to be taken into account. And it's not always perfect, but I think that each individual has kind of a range that makes sense for them to be optimized, so to speak. And I really call it that. I call it, optimization of your hormones.
Yeah. Yeah. And as I'm sitting here talking to you guys, I think I'm going to start every visit with, how are you feeling? And I think the next question I'm going to ask is, what has changed since the last time I saw you? I think that's a good question. And then you can kind of look at labs and, because people will typically tell you, and I love those people where you walk in the room and they're already crying, right? You're like, okay, this is going to be good. We've got some work to do, but at the same time, like, this, Dr. Dorfman, I think that especially women, but anyone in general who has a complex medical condition like your wife, Justin, when doctors don't know the answer, unfortunately, what we do is we put them in the loony bin category. We say, oh, it's all psych, right? It's psych related. Oh, it's depression. It's in your head. It's anxiety. Which is terrible, but that's what doctors do. And it's like,
that's exactly.
It's very frustrating. If I don't know everything by all means, and my patients will tell you. I had one of my patients I've seen for a long time come to me 2 months ago. And she's like, something's not right with me. And I looked and I thought, and I'm like, I don't know, but we're going to figure it out, And so I had to get on the phone and call some people. And we actually did figure it out and she feels better. But I don't know where medicine, like where we lost that, why everyone has to have an ego, right? And so if you don't know the answer, then obviously the patient's crazy.
That's the standard medical practice right there. Lots of ego. You can't possibly be wrong. And if you don't know what's going on, it's not your problem. It's definitely their problem.
Oh, I have to tell you, when my wife was really, really saying there's something wrong with my brain, there's something wrong, right? I had this accident. They never did the MRI. It was 10 years after the accident. We finally had the MRI. The neurologist did an exam and said, look, I see this all the time. There's nothing wrong with you, but I will do the MRI so I can put you at ease. I remember it like it was yesterday. The doctor called me and he was crying. He was crying before he even said his name. And I instantly went to, this is a really bad outcome. I said, is everything okay? He said, your wife is fine. He goes, but I am so, so sorry, because what I have seen in these MRI images is inexcusable for how I treated you and your wife and dismissed you in the room. And it regained my faith in the medical system, because he was sincerely affected that he was so wrong. He said, I have never seen an MRI like this in my life. And Dr. Dorfman can contest that there is a black void where there should be brain matter atrophied. And to have a doctor come back and be like that humble and say, I am so sorry. And then he went out of his way to try and help us in any way he could. Talks to your point that doctors jump to conclusions very quickly and they dismiss people. And unfortunately, I don't necessarily blame the doctors. I blame the system, because doctors get paid whether they spend 5 minutes with you or they spend 15 hours with you. The reimbursement from the insurance company is the same. And so the system is broken, not for patient care. It's broken because it's all financial based, not patient treatment based. And I think that's what's really affecting the world. And I don't think that we have a big hormone problem the way that is being treated with HRT. We have a cortisol problem. We have a technology addiction that's affecting the way that our biology works, preventing us to sleep, preventing us to make our own hormones naturally. It's as simple as that. We need to get back in line with how we function as humans, because we haven't evolved. As much as everyone thinks we have not evolved. We've invented amazing technologies that are now interfering with the way that we function and operate as human beings. And that's killing us. We are actually destroying the human race with technology.
Yeah, and doctors, we providers, we should be demanding better too, right? Because think about this too, like Dr. Dorfman, when you go to med school, they don't teach you to be nice to yourself, right? They teach you to stay up for 30 hours, take care of people, and so the problem, you're right, Justin, it's a systems problem, but it's there's so many problems, because I've thought about this, this will keep me up at night. So sick patients or things like that don't keep me up. But what does keep me up at night is the scary trajectory of healthcare in this country. I don't even know how you fix it, to be honest with you, because we don't teach doctors correctly, right? We teach them in and out, in and out. The system is so broken as far as how we spend money. Nobody's interested in actually keeping people well. They just want to keep them sick, in my opinion, because then insurance companies make money and hospitals it's a big money making system, right? If think right now, if all of you listening right now, think if you got 50% better instantly, if everyone out there got 50% better, I'm taking 50% less medicine, I'm going to see 50% less doctors, unfortunately, people would lose a lot of money, but actually we wouldn't. So I think people don't think about it correctly either, right? Because we spend so much money on healthcare, and it is bad money spent. It's at the end of life. It's poor life quality, as opposed to taking all that money and spending it on preventative health, right? And keeping people really well and having a functioning society. And so it's just, it's very frustrating. And this, Dr. Dorfman, I tell my patients, I stopped taking insurance recently for new patients, and some people got really upset. And I said, it's not that I don't want to take your insurance. It's that your insurance doesn't accept me. They don't accept me. They don't accept what I do. They don't accept how I practice. They don't accept what I think, because I don't want you to be sick. I don't want to see you every month, and I don't want you to be on all these damn medicines. I want to have a conversation with you for longer than 10 minutes. I want to know what your poop looks like. I want to know what you're eating. I want to know how you're sleeping. They don't care about that. Nobody cares. And it's really frustrating.
It's totally true. I think, my practice is similar, I guess, in a sense that I also am outside of the insurance network, although when people need testing, I do help them use their insurance. But for my consultations and my time, you can spend as much time with me. It's the same, it's a monthly fee. So I'll spend 20 hours with you, or I'll spend 5 minutes, whatever you need. But the bottom line is the restriction is all based on you're fixing your medical problems and applying a ton of preventative strategies that are out there that insurance companies will not pay for. And part of it is exactly this: managing cortisol, right? I mean, I do a talk on sort of a more germane topic for cardiology, which is lipid lowering therapies, right? Statin drugs and Repatha and all these things. And I have this slide, and the slide shows all the contributors to cardiovascular disease, to heart disease, to heart attacks and strokes. And, a lot of people, I ask people to guess, and I'm saying, what do you think the biggest contributor? What do you think the next? Well, the second biggest contributor, based on all the science and literature, is actually stress and anxiety. Yeah. It's bigger than diabetes. It's bigger than not exercising. It's bigger than, all of these other things. So we need to this has to be part of our preventative strategy, to use a product like Rebalance, to normalize sleep, to normalize cortisol levels, to measure those things, to have conversations with the patient, because you're really preventing disease moving forward. I mean, that's the way I think about it.
Yeah. And, to this point too, if you are a provider listening to this, think about your day, right? So I'm going to say that I take care of providers. They're some of the most stressed people in the world, right? Because, just think about what we do to ourselves, right? Your schedule's full. You've got people calling that are sick. You try to see them too. You don't go to the bathroom. You don't eat lunch, or you eat lunch standing up, so you don't chew your food, so your gut's a wreck. And then you're doing your notes all night long, so you're not sleeping. Doctors are like the biggest ball of stress in the world too, right? And a lot of people are, but in general, I'm just saying, the way that we do it is so unhealthy. And it took me until thankfully in 2020, I started figuring it out. And then in 2022, I kind of got sick again, and I was like, this is crazy. And then this year, finally doing the things I'm supposed to do and taking good care of myself and being less stressed, I'm like, yeah, I'm not going to do this anymore. Like, I'm just not, you feel better. You can take better care of people. And it is, I mean, it's just different. So as far as stress goes and rebalance goes, can you guys give a summary as to like, I guess what it is, how you take it, who it would benefit? Do you have to get it from your doctor? All of those questions that everyone's thinking in their head. Because now everyone is thinking, by the way, because everyone has problems with sleeping. Well, maybe it's my cortisol.
Right.
Maybe I should apply this, right?
Yeah. Right.
So the way we designed it was we wanted to make it affordable to everybody. So we have been very kind of maniacal about keeping our costs low. So it's $99 a month. You get 3 products in the system. You get the morning, you get the afternoon, and you get the bedtime products. Mm-hmm. They all lower cortisol, but they're different formulas because you need different ingredients at different times of the day. Mm-hmm. The way that it works for me, there's 2 lozenges in the morning. They're like a herbal mint. They're nice minty flavor. They're strong. So after I brush my teeth, I pop 2 in my mouth. I suck on them like you would a cough drop, favorite mint. And they dissolve in your mouth within 10 minutes. That's it. Mid-afternoon, typically for me and Dina, we eat a lot more of them because we're addicted to them. And we pop them in our mouths around about 3-4 o'clock in the afternoon. 2 more lozenges, you suck on them. And what that does is it helps bring cortisol down. It starts transitioning you from what I call work mode to play mode. And play mode is being with the kids, friends, family, loved one, going to the gym. It gives you all the energy you need, but it's bringing that cortisol down. Mm-hmm. The idea is that by the time you're ready for bed, you brush your teeth, you wash your face, you've had a shower, whatever, literally as I'm getting into bed, I pop the 1 bedtime lozenge in my mouth, and within literally a few moments, I am asleep. Why? Because my body's cortisol is low, my natural melatonin has been released. There's a little bit of melatonin in the nighttime product that's going to help you fall asleep. All the other ingredients in the bedtime product help you stay asleep for the 7 to 8 hours that we need as adults. So there's no compromising those facts. Every adult needs 7 to 8 hours of sleep every night, uninterrupted, in order to maximize your hormone production for the next day. That's it. Very straightforward. It's a monthly subscription. And we have it in 3 different packaging. Now, they all do relatively the same thing with slight tweaks. The first one is the hot flash menopause product. Very important. But by bringing cortisol down, as our study showed, we can actually support menopause. We've had people that have said, I can't get more than an hour's sleep. And then within 30 days, they're like, I've had the best 8 hours sleep of my life. The second system we offer is a testosterone system, obviously more focused towards men. Believe it or not, men go through, and you know this as a doctor, andropause. It's the same as menopause, except it's stretched out of 40 years, starts in our mid-30s, ends in our 70s, and we suffer from the same symptoms. Not very men feel them, but if they stop and think about it, yeah, I threw the covers off myself last night. Yeah, you weren't hot, you were having a hot flash. You're gaining weight, you're losing muscle mass, you've got brain fog, all same symptoms of menopause, but at a fraction of the intensity that a woman feels it because they go through it in a much condensed period of time. So we have testosterone. Now, you can switch. They're not gender biased in any way. Women take testosterone because they're like, I'm not going through menopause yet, but I want more testosterone, and this product's going to help with that. They take that. We don't have testosterone in the product, by the way. It's just formulated with a little bit more natural ingredients to promote and support testosterone development.
So does it have like DHEA or what do you, I mean?
Horny goat weed, Ester surge, different ingredients like that. In the hot flash system, we use things like bacopa and oat straw because women's nervous systems are far more sensitive than men. So I want to calm down the inflammation, calm down the nervous system. Women are in tune with their hormones. They've been in tune since they went through puberty. Men, we're Neanderthals. We've got no clue. It hits us like a brick in the head in our 40s and 50s when all of a sudden I can't get it up as well as I used to. I'm gaining weight. I'm losing muscle mass. I'm losing my hair. And men don't talk to men about this stuff, but they'll go to the doctors and discreetly say, can you help me with this? Well, that's why HIMS is a $1.8 billion IPO, because it's discreet ED medication to your door. So there's a testosterone product. Last but not least is an anxiety product. The majority of the world is suffering from anxiety right now, especially as the election comes closer. It's going to get out of control. The anxiety levels are going to be off the chart. And so what are we doing? We're trying to help calm everything with anxiety through the same processes: lower cortisol, support cortisol to help you get a good night's sleep so you can naturally make the hormones that you need to make. It's as simple as that. 3 systems: hot flash, testosterone, anxiety.
And they're lozenges that you take throughout the day. I'm assuming there's no sugar, so my diabetic patients can take it. You don't have to worry about that. There's no gluten. There's no anything like that people with allergies are going to have issues with. Dairy. I don't do gluten or dairy, so can I take your products?
Yes, you can.
Okay. Yes.
We do have a dairy warning on the product. There's no dairy in it, but it's made in the facility with, and so we have to put the disclosure on there. But there is no dairy in the product. There's no wheat and gluten in the product. There is no sugar in the product. It is more earthy in flavor because, again, if it didn't move the needle, I didn't put it in the product because I want to go back to the story. I built this for my wife. I was very selfish. I did this for my wife. If it wasn't going to help her, I didn't put it in there. I didn't add fillers, flavors, artificial colorings, nothing in there. It had to help her because if we go back to the very beginning, I thought I was going to lose her.
Mm-hmm.
And so
how is your wife?
She is thriving. I mean, she's got a brain injury, and if you've ever seen Adam Sandler's 50 First Dates, that's us. We forget things all the time. I ask her all the time, do you remember who our kids are? And do you remember where you left them? It doesn't matter about anything. All right, but essentially, but she's sleeping and she's thriving and she's working out and having a great time. But that is a big difference. This isn't a big pharmaceutical, nutraceutical company trying to make a big buck. I started this company to help her, and I didn't compromise on the quality of ingredients or what I put in it. It had to move the needle for her, and it did. And it just turns out that we can help the entire population pretty much at this point if they need help or they wish to get some help.
So let me ask you this. How long would somebody have to take this for them to then do labs and notice a difference? Because I'm a very lab oriented, obviously you may feel better, but let's say I'm going to take it now. So let's say I'm going to do the testosterone one, the testosterone boosting one, because I'm not going through menopause yet, praise God. When I joke that when I do, though, it's going to be miserable, right? Because I've helped women through it for so long. I'm sure God will just put me in there. But
I'll be happy to take care of you when you go through it. Yeah.
Great. But so let's say I want to take the testosterone boosting one. Would I do it for 2 or 3 months before I redid labs to see? Because I'm very curious, what it does to your cortisol. And then I'm going to wash out, and then I want to take the stress one. So what would you recommend? 60, 90 days, Dr. Dorfman, and then wash out for 30?
Yeah, I think it's very, sorry.
A washout won't make any difference. Both products do the same thing in terms of supporting cortisol.
Well, I just want to look at my numbers. I'm just a weird number person. I'm going to see if there's a difference if I take the one that boosts my testosterone naturally and don't take testosterone versus if I, see what I mean? If I'm just taking the anxiety one.
Basically, if you kind of the only real gauge I have is the study we did with 104 women and kind of looked at their responses, and women started to feel benefits within even a couple of days. Mm-hmm. The longer women stayed on it, the higher percentage of women got benefits, and those women got more and more benefits. So that study went out about 90 days. So I tell people, 3 months, about 90 days is a good trial period. I think that's very reasonable. And I think if you wanted to do a washout, a month of a washout and then retrying for 90 days makes sense. The one piece that I want to mention, however, is it's like we talked about before. It's really hard to peg these hormone levels, right? So, for example, there are a lot of variables that go into your free and total testosterone levels, right? Before you mentioned sex hormone binding globulin. Are you going to the gym or not? Are you sleeping or, so it's hard to say that your testosterone went up and that's because of the product. And when you're off it, the testosterone went down and that's because of the product. The product's certainly contributing to that, but looking to sort of fine tune that and to really do it scientifically is quite difficult. It's almost like measuring cortisol levels, right? You can measure it 4 times a day in saliva. You can measure serum levels. You can do all sorts of things. It depends. Did you almost get hit by a car that day, and did your mother yell at you, or did you win the lottery? And so there's so many variables that I think the caution is it's hard to kind of structure this from looking at labs, as much as I'm a lab person also. And I think a lot of what we did, certainly in the study, was subjective clinical data. How many hot flashes are you having? How do you feel? How are you sleeping? Are you irritable? All of those things. So I think that the only caution is, it's probably hard to measure these things super scientifically, but within ranges, like we talked about before, I think it's totally valid.
Mm-hmm. If I could add one point to that as well, we are not a magic pill.
Nothing is.
Right.
Yeah. Nothing.
You cannot sit on the couch, eat bonbons all day, watch movies, take the product and go, well, my cortisol hasn't changed, right? Or my testosterone hasn't increased, right? It does involve having good sleep hygiene and setting yourself up to win. Right? You can't be going to bed at 1 a.m, waking up at 6 and being like, well, nothing's changed. But you've got to make a conscious effort to change your lifestyle for your health and for your optimum performance. And so that involves a healthy diet, drinking plenty of water, making sure that you do exercise, and it doesn't matter what, but just exercise, ideally burn more calories than you consume, just having good kind of, a lifestyle is in line with the product, but it is not a pharmaceutical, so one mustn't expect miracles with it if that's the kind of critical test that one's going to do.
2 points. Number one, even if it was a pharmaceutical, there is no pharmaceutical I can think of besides antibiotics that are a miracle drug. Okay. Right. So most pharmaceutical drugs are crap, and they are things to cover up symptoms. The caveat to that is antibiotics if you obviously need them. Number two, I agree with you. And that's why at Modern Endocrine, we use like a 10 stages to health system. So if you look on our website, we have these 10 stages we take people through in order for them to have better health. And so we're very, I am very, very strict on that. Like, we have to get your cell membranes functioning well so they can absorb hormones. We have to get your gut right. We need to look at your micronutrients. What does your nutrition look like? We talk about exercise. We talk about sunlight exposure. Mm-hmm, we talk about sleep. We talk about stress. We talk about sexual wellness, relationships. And so we look at all of these things, and I completely agree with you. There's no magic drug, and they all have to be going in the right direction in order for you to feel better. But, I think that this is a great way to start in lowering your, cortisol, helping people make little steps. And that's what I talk to patients about. Let's start somewhere. So let's start this month on, what are we going to talk? You want to do food? You want to do exercise? Do you want to just go outside and walk every day and look at the sun? Because that's another thing people don't do. It drives me insane. We just moved to our new clinic 3 days ago, and I made a huge fuss. My builder, I think, thought I was insane. I was like, I want windows everywhere. Do you understand? But you have to make them HIPAA compliant windows. So I need high windows everywhere. And he was like looking at me, I'm like, I'm serious, Chris. I want them everywhere. Like, everywhere we need windows. Do you understand? And he's like, what is it with you and windows, Cassie? I'm like, I want natural light everywhere, because I came from this dark, just decrepitous clinic that just made you like, And every single patient I've seen for the last 3 days, you know what they've said? It is so bright in here. It is so nice. Like, just sunlight is like huge for your mood and then, I make my staff go outside and walk every day at lunch too. And they get mad at me. I'm like, nope, shut up. I don't care if it's 106 outside. Let's go. We're looking at the sun. Like, you need sunlight. It's important.
Yeah. Absolutely.
So then here's my other question for you. Let's say you're a woman and you are on testosterone replacement. Would you be better off than maybe taking the stress one just to help with like lowering stress if you're already taking testosterone replacement? Would that be your thought?
I think that's one thought for sure. You could complement the hormone replacement that you're already on, certainly, especially if you tend to be a sort of higher anxiety, sort of stressed out person. I think another thought is you could use the testosterone product potentially and use less of the testosterone hormone replacement therapy, which is something I do, fairly frequently. And I know, and I do want to sort of mention one thing because we alluded to it a little bit, but it's really that I think super important from a scientific standpoint and sort of from an absorption standpoint is the concept of this sort of direct line delivery system, as we call it, which is the concept of a lozenge, right? Like, here's a great example, like vitamin B12. Okay, as we get older, we don't secrete enough intrinsic factor. It gets harder to absorb. Some of the patients you mentioned earlier, Dr. Smith, that are having a bunch of gut biome issues, chronic constipation, small bacterial overgrowth syndromes, all those things, they don't absorb well. Period. End of story. But we can bypass that whole GI tract absorption. And to me, I think it's a really important design of the product. And the fact that we were able to prove that you get higher levels. We tested melatonin, as Justin mentioned, from a lozenge versus a gummy versus a pill. So it's not like you can just take these ingredients and swallow them all and get the same effect. It really has to do with the mucosal absorption. And I think that's kind of an important point to make.
Mm-hmm.
Okay. So for my listeners, I will do this for you. I'm going to do this and I'll do some labs. And then in like 90 days or so, I'll let you guys know. I know you guys said checking labs, not super intuitive. I'm more of like a feelings person though. So I'm very in tune with my body. You can ask my husband. I know when I need an iron infusion. I know. I've been very well. I've been very sick. I've been everything in between. And so, but I do know that I have been more stressed recently. So this couldn't have come at a better time just with like moving my practice. And I say the word stress. I don't like that word. I have been excited. I try to change how I say that. When you have a lot of good opportunities coming up, instead of using the word stressed, you're supposed to reframe it as I'm very excited, right?
Right.
And so we have a lot of things that we're working on, and some of them are going to be really cool. Some health summits online and stuff like that. It requires a lot of work, but the great thing is I know that we're going to get it done, and there's going to be a lot of good education for you guys, and it's going to be free. And so we're going to make it happen. All that to say, I just have a little more excitement in my life. So I think this would be a perfect time to try this and, make sure that I'm feeling good. So we will. And then I think you guys sent Stephanie a promo that we can link, right? Where people can get a discount on the product. So we'll link that in the show note, you guys. The show notes we'll make sure that the show notes, and then when we post this on Instagram, we'll make sure you guys have the link and the code. So they're going to give you guys free shipping and special pricing, it looks like, for that. And so I'm excited you guys came on and told us about this. I appreciate it. Cortisol is a huge topic that we talk about in general. I have 3 questions that I end every podcast with. So you guys all will just like 1, 2, 3, you get to come up with a 1-word answer. But I love this because it's good. I have patients who literally like say stuff about this all the time. So the first question is, what is one food that you feel is the most beneficial and why? And it can be anything, but you get one food.
An egg.
Okay, why?
Has all the protein, vitamins, nutrients that you need for the day. It's a great way to start the day.
Okay.
Beans.
Why?
Oh, you guys take my answers.
Lower, a great source of fiber, helps with gut health, helps with metabolic health. It's a great source of protein. No saturated fat. I could go on and on.
Okay. Eggs, beans.
Yeah, I honestly, those were 2 of my answers, but I will go with, for me, I love blueberries.
Okay.
Great.
That's mine. I love blueberries. Blueberries, avocado. I can't pick just one. I have a lot of favorite foods.
Yeah.
Okay. Those are pretty common ones. Actually, I don't know if anyone said beans, Dr. Dorfman. I don't think anyone said beans. I get a lot of eggs. I get a lot of blueberries.
Anyone say chocolate? Anyone say chocolate?
Actually, I have had somebody say dark chocolate. I agree. Okay. What? And I just like this because this helps people, if you listen. So this is, I think, our 20th episode of this podcast. If you listen to this podcast enough and you're at a restaurant or you're somewhere trying to make a decision, you're going to remember those foods. And ideally, you're going to choose the healthier food versus the unhealthy food, right? This is easy, like easy, free. education. What is one easy health tip that anyone can do that's free? So what can you do to improve your health that's free and easy?
Exercise, walk, just like you said. We live in Boulder. There's like hiking everywhere. Hike, get outside, turn your phone off. All the things that go around being with nature. What's the old saying? Make sure you stop to smell the roses or something like that. Like you can't be on a hiking trail about to run into someone because you're texting.
Correct. So walk outside. I love that. I incorporate that in my life 3 times a day. It's not negotiable. Justin?
I'm going to say grounding. Take your feet in this naked form and stand in Mother Earth.
I knew you were going to say
and learn.
You get to go first next time. Grounding, walking outside. What do you got?
Meditating.
I love that one. I agree. Meditating.
Important. Very important.
Mindfulness. I will also tell you, I started incorporating mindfulness in my life and great gratitude. So gratitude, I started it's been almost 2 years now. And I make a point every single night before I go to sleep to find at least one thing I'm thankful for that day. It doesn't matter. I've had some bad days in the last 2 years, but you can always find one thing that went well. And if you do that, I think it changes your mindset a lot. And it's easy. It doesn't cost any money. You can do it anywhere. You could do it anytime. You don't have to do it before you go to bed. Sometimes in the morning, I do it in the morning, but I think that gratitude is great. And you can do that mindfully,
Yeah. I do it morning and night.
Yeah.
It's important.
And if you write it down, that's pretty cool too. But, and then I'm going to really challenge you. If you think of somebody that you're grateful for whatever reason, and you reach out to them, even if you haven't talked to them in forever, sometimes it's really cool. Like, I've sent friends text messages that I haven't talked to in a long time because I just thought about them. And, I was like, hey, remember this time we did this? I'm really grateful. You're my friend. It's cool. They usually respond back with something really nice, and then it kind of changes your day. So
yeah, it's a great idea.
Yeah.
Or even if you just send an email to somebody at work, like, hey, yesterday, you cleaned up in a room after I left this room and I came back to clean it and you did it. I really appreciate that. Just little things like that. I think we're such a driven, fast-paced society that we forget to be kind to one another. And little things like that mean a whole lot. So
you can shift someone's whole day.
You really can.
Okay,
the last question. You get to go first. What is one thing you wish you would have known 10 years ago about your health that you know now?
I think to take it more seriously as I was younger. Absolutely. Not just take it for granted as I was younger. I would start earlier.
Okay. Dr. Dorfman? That the ER was bad? It was bad on your cortisol?
Yeah, honestly, I was sort of going there. Like I think I've been so caught up in, again, like it feels really good to help people. And I was terrible with boundaries up till about 3 or 4 years ago. And, I worked, 24/7 literally, running the trauma department, running the ER, running all the police, fire, and ambulance stuff. I was on the phone all the time. I was up all the time, and it probably negatively affected my health. And I wish I would have created better boundaries earlier in my life. And boundaries, I mean, taking time out for myself.
Justin?
The decisions that I made in my youth affect my physical abilities as I got older, and that maybe abused my body a little bit more than I should have in order to have quality of life as I got older.
Yeah. Yeah, I think the most common answers I get are sleep, boundaries. And then, with me, I think mine was I just really wish – I'm a woman that lives in the United States, right? So in your 20s, everyone wants to be stick figure thin. Absolutely. And no muscle, and it doesn't matter. Starve yourself and run on a treadmill. And, I did that in my later 20s, and then I got to be 30 and I was like, I feel like crap. I guess I look kind of cool, but not really, because I looked sick almost. It's just like, I wish that 10 years ago, I would have known what I know about muscle now and cared about that more than anything. Because when I'm 85, y'all, I'm going to be able to bend over and tie my shoes, get off a toilet and wipe my own butt. I promise, because I care about muscle and I eat enough to make sure that I'm going to have muscle, and I have this conversation with people all the time. Like, I don't care how much you weigh. I care how much muscle you have and if you can do the things you need to do for the rest of your life. And so I think just, things like that are important, that people understand that. So
It's true. It's not all about vanity. I did the same thing you did.
No, it's not.
There is a lady that is at the gym every morning with Jody and I. She is 92 years old. She walks to the gym every day. She does leg raises on the ab machine. She is a machine at 90 plus years of age. She is something that we strive to emulate when we get to that age.
That's going to be me, Justin. I'm going to the gym every day. And then I'm going to put on my bikini and hang out outside and read a book. And I don't care what anyone thinks about my bikini at 92.
You'll stop caring at 50.
The great thing is I stopped caring about 2 years ago. I don't know. It just happened. Like, I just literally don't care at all. Like, I'm happy with, I go to bed every night and I sleep really well. Like, I know I take good care of people. I try to be a nice human. I eat my protein. I practice what I preach. I stopped caring 2 years ago. So I made it in life as far as I'm concerned, right?
That's awesome.
That's all that matters.
Yeah.
Your perspective.
You have to be like that when you're in social media too, because if I read every comment people put on my social media and took it to heart, I'd be a pretty upset person. I don't even read them.
Yeah.
Like, whatever.
Yeah.
I don't even care. Like,
Right.
So,
Yeah.
Well, thank you guys so much for being on our podcast. Like I said, everyone, make sure you check out Rebalanced. We'll link it all in the show notes. Cortisol is very important. I talk about it with my patients all the time. We've actually had some cortisol experts now come on and chat with us. And so I appreciate your time, and make sure you join us next week on Back to the Basics. We've started dropping our episodes on Sunday, so you guys have something to do on Sunday. So I do listen to you guys because I know Monday everything else drops. So now we're dropping on Sunday. Have a good week.
The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.